Are you or someone you know addicted to a device, a phone, a tablet, a Game Boy, looking at it for long periods of time, not paying attention? Well, there is a name for the disease they're afflicted by, and it's called digital toxicity. Easy for me to say. Here to tell us about it, Nicole Kerr, director of the Castle Wellness and Lifestyle Medicine Center, is here. Thank you for joining us in this Living Healthy segment. This is a really good topic. You and I were talking a little bit behind the scenes about it. This is a problem.
It absolutely is a problem, and it's actually getting worse. You know, technology is a wonderful tool. However, it's the use of technology that can be problematic, both in terms of the quantity of time that we're spending, and Americans now are averaging, get ready for this, 10 hours and 39 minutes a day in front of some kind of device. And teenagers are about at 9 hours a day. And it's also the quality of the stuff that we're watching. You know, technology could be used for good, such as Skyping your grandma across the world, or it can be used for bad, such as bullying on social media.
Yeah, my grandmother actually is on social media, so it's kind of funny that way. But, and yes, a lot of us do use it. My rule in the house is to not allow the kids at the dinner table to do it, but I too fall victim to it. Are we addicted? I mean, you said almost half a day we're on that. Is there such a thing as an addiction?
Yes. Me and several other health experts agree there is such a thing as internet addiction. And what's particularly concerning is video games. You know, they're designed to be addictive, which is really one of the problems because it taps into our dopamine reward system. And dopamine is that feel-good neurotransmitter. And so, you know, when you have that built in, you just want to keep doing it and keep doing it and keep doing it. And it is very addictive. In fact, in Japan, China, and South Korea, they've already declared it a public health crisis. And there's a couple of reasons why I think it is a public health crisis. And the first is that it is designed, the technology uses it to be as addictive as possible. Second, it's influencing our mental well-being. We now have things called digital dementia. We're outsourcing our memory to these devices. Most people cannot think of what their husband's phone number is or their kids' phone numbers because all they're doing is just pushing a button now. Used to, you had to dial in the number. So it's our short-term memory. We're starting to lose more of it. One of the other things is digital depression is now a big thing. We have increased rates of depression. 10% of Americans have depression, but heavy internet users are reported to have 2.5 times higher incident of depression.
My goodness.
Well, we're social animals, you know, designed for social connection. And we need that face-to-face, just like we're talking today, one-on-one intimacy. And you're not going to get it from Facebook friends and internet Twitter followers, you know?
Well, so then that leads me to my next question. How do you detox from it? How do you get a digital detox?
Well, there's a couple of different ways. There's a couple of criteria that maybe you want to look at. Do you look at your phone first thing in the morning and last thing at night? It's interesting that people look at these phones even when they're not ringing or pinging or dinging or donging. And
that's not getting an alert.
Yes, and that's about 67% of people, and they're called phantom rings or phantom vibrations. So it's almost like these devices are controlling us. You know, other things to think about, can you get through a meal without looking at your device? You know, you go to restaurants now and the whole family is on their different devices. You plug the kids in front of the iPad to watch a movie and nobody is talking. People go out on dates, they don't get to know each other, they're on their devices.
You said something important real quick, and we only have about 30 seconds left, but for an 18-month-old, there was a recent study just released last month about how the amount of screen time for children 18 months old is tied to expressive speech delay. That means they're not able to say how they're feeling or what's important. And that is really concerning because that's using only 30 minutes a day in front of a screen. And the American Academy of Pediatrics says no screen time for children under 18 months except for chatting, video chatting. We're out of time, but this is such a good topic. How can somebody get more information real quick? Go to your website?
They can go to our website or they can call us at Castle, or I'm available to do presentations for them.
Nicole, thank you so much for being here. I appreciate that. This is an interesting topic and one that I think a lot of people should pay attention to.